And we're going to talk right now about some examples of some combination estrogen and progestin birth control pills. So there are a lot of different combination oral contraceptives, and they each have a few different qualities that we want to think about. We want to think about the fact that dosing days are based on 4-week months. And so the dosing days are almost always going to add up to 28. So you'll see a pill pack that says 21/7, and that's going to mean you have 21 days of active pills and 7 days of placebo or inert or inactive pills. There are a few that have put together several months at once, and you'll see things like Seasonal and Seasonique. Each of them are going to have a different type of progestin. So remember, those progestins can have different amounts of estrogenic activity, different amounts of androgenic activity, and different amounts of aldosterone-like activity. So when we look at these pills, we want to look at which progestin is in it and what the activity of that particular progestin is going to be. Almost all estrogen in birth control pills is going to be ethinyl estradiol, although there are a few with mestranol. This is what you're normally going to see, this ethinyl estradiol. And we categorize these pills based on the amount of ethinyl estradiol. So a standard estrogen is going to be 0.035 milligrams per pill. Then we have low estrogen and low estrogen. We also refer to these pills by phasicness. And phasic just means how many different types of active pills there are per month. So an example up here, we have 1, 2, 3, 4 colors, but we know from the information they're going to give us that one whole set of colors is an inert. So that's going to tell us we have 1, 2, and 3 active pill types. So this is going to be 3 active pill types, so that's going to be triphasic. So when you talk about monophasic, biphasic, triphasic, or quadriphasic, you're not counting the inert pill types. Normally, in a bi or triphasic combination oral contraceptive, the amount of estrogen is usually going to stay the same, but often the progestin concentration increases. So you might have a lower progestin in this first, a bit higher progestin in the second set, and the highest progestin of that pack in the third, and then in the inert, we have 0 progestin and 0 estrogen. You can also see some oral contraceptives that have added some things like iron or folate, and those have nothing to do with the contraceptive activity. So if iron and folate don't have anything to do with contraception, why are they there? And honestly, the reason they're there is to look good for marketing. Pharmacologically, these aren't having any real effect. So the idea of adding iron is kind of being sold as women are losing iron during their menstrual period. Therefore, if you give them iron during the inert or placebo pills, you're going to replace some of that iron loss. And in reality, the amount of iron in those placebo pills is so small compared to the amount of iron that would actually make a difference that even the company itself says these do not serve any therapeutic purpose. The other addition you might see is that of folate, and folate is really important if you think back during pregnancy in terms of avoiding some of those early birth defects. So the companies state that they're raising the folate levels for women who choose to use an oral contraceptive for contraception. That's their explanation of why it's there. Now, we know it's certainly possible that a woman using an oral contraceptive completely accurately could still get pregnant. So in that sense, maybe it makes sense that all women of childbearing age have folate at all times in case they do get pregnant. But it does seem like a bit of an odd choice pharmacologically to manufacture and sell these based on this addition. So there are an astonishing amount of oral contraceptives on the market. And so what I'm going to do is only have you learn about 4 of them. They're fairly commonly used in the US, and they're great examples of the way these contraceptives are put together, so that when you see other ones with similar ingredients and similar dosing strategies, you'll already be able to understand what they do. So the first one we're going to look at is orthotricycline. This is a very common oral contraceptive, and it is a combination of norgestimate, which is our progestin, and ethinyl estradiol, our estrogen. And when you look at the package, it's going to say that it has 3 different combinations of progestin dosing and 1 estrogen estradiol dose. And it's going to call itself a 21/7. So that's going to add up to 28 days in the pill pack. When you look at the pill pack itself, the fact that it has both a progestin and ethinyl estradiol is your cue that this is a combo pill. When we want to look pharmacologically at what that progestin is going to do, we see that it's norgestimate, and knowing our progestins, we know that that has a medium androgenicity, has high estrogenicity, so it might be a little bit higher on the rating of clotting risk for oral contraceptives, and it has no aldosterone-like effect. For the dosing, it's 0.035 milligram of ethinyl estradiol. So that's a pretty standard estrogen dose. That's not a low dose. And we saw that 21/7 added up. But we saw there are 3 different doses of pills and 7-day placebo. So we had our first set of 7, second set of 7, third set of 7, and our placebo. So what does this look like for the kinetics of using these? I have here just a conceptual graph. So as you can see, there's no units. We're talking about serum concentration of estrogens and progestins, and the half-lives aren't exact. We're trying to just get the idea of what's happening with these pill packs. So if the red is progestins, you had 7 days, up the dose, another 7 days, up the dose, another 7 days, and then the last 7 days, you had from 21 to 28, you had no progestin at all. So that's just going to decline based on the half-life of the progestin. The progestin drops, you initiate the shedding of the endometrial lining, and then you're going to get your menstrual period somewhere in here. The green is your estrogen or ethinyl estradiol levels, and those are staying the same throughout all of the active pills. And you know that because there's only 1 dose up here, if you look at the top, only 1 dose given for ethinyl estradiol. So you know that that's got to be there at the same level for all of the active pills. So that just goes along at the same dose. And then on day 21, when you hit those inert pills, those just drop down according to the kinetics and the half-life. And again, you then have this whole period here that doesn't have any estrogen. Now that matters because this no progestin period of time is going to initiate the menstrual period, and the no estrogen period of time is also going to have its effects. And one of the things that we see for some women, not all, is that this estrogen drop can actually cause some neurological mood changes, and we have what's called PMDD, or premenstrual dysphoric disorder, in which that drop and lack of estrogen for that 7 days is enough to cause mood changes. So we're going to look at low estrin, Fe. So the first thing we notice here is that this Fe stands for ferrous fumarate, so that's iron. And you can kind of figure that out from the last 2 pills here, look like iron. So this one has norethindrone and ethinyl estradiol. It has 0.1 milligrams ethinyl estradiol. And the different pills have either 1 milligram or no milligrams of norethindrone. And we call it a 26/2. So this is going to look a little bit different. We know with this norethindrone and ethinyl estradiol that it's a combo with iron. We know that the progestin being norethindrone means it has a medium androgenicity, but has a low estrogenicity, so less clotting risk, and no aldosterone effect. And this is a very common progestin to use. So when we look at that ethinyl estradiol dose, 0.01 milligrams, we can see it's a low estrogen dose. And 26/2 means that you had 26 active pills and 2 placebo. So if these are the 2 placebos, then we can see that we had all the rest of these are active. In the case of this pill pack, all of these blue ones, all 24 of them, are all going to be the same pill. Then the next 2, which are white, are going to be estrogen only. And then you have the placebos. So these are biphasic because you have 2 types of active pill. But what's interesting about these is you don't actually go to the placebo until the very last 2 days. So instead of a 21/7 where you had 7 days of placebo, now you only have 2. So what that's going to look like on this chart here is you're going to have your progestin keeping going. Instead of at 21 days dropping, now you're going to keep it till day 24. And so you're not going to have that drop in progestin until then. So you're not going to start shedding your endometrial lining until later on in the month. So you're going to have a period that's going to start later in that last week. When we look at estrogen, we can see that the estrogen level is going along through the month. But here, instead of ending at 21 days or even at 24 when the progesterone ends, we wait until 26th day for our last estrogen pill. So now you only have 2 days for estrogen to go down. So let's change that to 2. 2 days of no estrogen. So when we said that those days that you had estrogen drop could cause premenstrual dysphoric disorder, what we found is if you can reduce that estrogen drop or keep the estrogen-free days shorter, then you're going to have less chance of having premenstrual dysphoric disorder. So any pill that has this estrogen dosing that goes beyond day 21 is doing that in order to reduce premenstrual dysphoric disorder. And if I ask you about low estrin Fe, you're going to be able to identify that Fe is iron. You're going to be able to, if I gave you the picture as well as this information, so both of these, you're going to be able to tell me which progestin is in it, what the properties of that progestin are, where the placebos are, how many days of placebo you have, and you're going to be able to tell me how many days of progestin free and how many days of estrogen free and what that means in terms of clinical effect. Yaz is another very popular oral contraceptive, and in Yaz we have drospirenone, ethinyl estradiol. We have only 1 dose of progestin, 3 milligrams, and we have only 1 dose of ethinyl estradiol. So all the active pills are the same. And then we have a dosing regimen of 24/4. So that adds up to 28, and we have 24 active pills and 4 placebo pills. And you can see those 4 here. So having both the progestin and ethinyl estradiol, we have that combo. We know that drospirenone is anti-androgenic, has medium estrogenicity, and is anti-aldosterone. So immediately when we see drospirenone, we know that it's going to have some kind of special progestin activities that are going to interest us. And since androgenic activity increased acne, our anti-androgenic progestins can actually decrease acne. The medium estrogenicity means we don't have a really low, but we also don't have a really high increase in clot risk. And the anti-aldosterone activity means you do need to look out for anti-aldosterone side effects. So we had our 0.02 milligrams with ethinyl estradiol, which was a low estrogen dose. And then we had, as I said, only 1 type of dosing, so it's uniphasic, then also these 4 placebo pills. So when we look at 2 things about Yaz that are really interesting, that you really need to be able to identify if I ask you about Yaz, is that it also has those additional estrogen days. So those 24 days of estrogen and only 4 days with no estrogen are going to keep the estrogen levels up longer or are going to give you fewer estrogen-free days. And so again, that is always there in order to help reduce PMDD. The second thing that you need to know about Yaz is what are the ramifications of drospirenone. And again, since it's least androgenic and decreases acne, that's one of the things the manufacturer sells about it, is if you take Yaz, then you not only are using an oral contraceptive, but you might also have decrease in premenstrual dysphoric disorder and a decrease in acne. So that sells pretty well. However, because it is aldosterone-like, the drospirenone, it can increase potassium and cause hyperkalemia. So that's something that you want to be aware of. And then the last oral contraceptives that we're going to talk about are extended use. And the first extended use brand was Seasonal, and now they've gone generic. And so there are a lot of different brands that you can use that are going to give you a similar effect. And really, all that is it's a normal levonorgestrel ethinyl estradiol pill, but instead of 4 weeks on and 1 week off, they give you 12 weeks on and 1 week off. Seasonal's patent ran out, so no surprise, the manufacturer came out with Seasonique. And the difference for that is only that instead of the 7 placebo pills here, we have 7 estrogen pills. So the whole thing looks the same. You have the 12 weeks combo, but then the last week has no progestin. So progestin levels drop, endometrial lining sheds, you get a period, but no drop in estrogen. So also decreases risk of premenstrual dysphoric disorder. So when we look more closely at Seasonique, we see that it also is a levonorgestrel ethinyl estradiol pill, that it has 1 dosing level of progestin and 2 dosing levels of estrogen, and that is a 91-0. So the first 84 pills are estrogen at 0.03 milligrams. That's a low estrogen. And the last 7 pills are ethinyl estradiol at 0.01 milligrams, which is a low estrogen. So they do drop the estrogen level in those last 7 days. So when we look at the graph here, we can see that 1 month, 2 months, 3 months, plus 1 week. The first 4 weeks, second 4 weeks, third 4 weeks, we have the same estrogen dosing. And then the last 7 days, we drop to that lower estrogen dose, but we don't drop all the way down. So then after the 7 days, when we start back up again, it goes back up here. And again, the things that you want to really remember about the distinction or the difference for Seasonique is that the 3 months without a progestin break means that the patient will have a menstrual period only 4 times a year, and the continued estrogen dosing through every pill will decrease the drop in estrogen and reduce the risk of PDD or PMDD. And then you also want to ask yourself, what are the properties of this progestin? And so this looks pretty good, but when you look at levonorgestrel, you see it has that high androgenicity, low estrogenicity, and no aldosterone-like effects. So the low estrogenicity means lower clot risk, but the high androgenicity means you might have an increase in acne. So hopefully understanding these 4 examples of drugs can help you understand what it means when they say they're biphasic or triphasic or quadriphasic, that you can look at a combo E&P, look at the progestin that's involved, and tell me what types of risks and what types of properties and benefits that one may have. You'd be able to look at the estrogen or ethinyl estradiol dose on any oral contraceptive and say whether that's low, or moderate estrogen dose. And you'd be able to say how many placebo pills there are, when a person's progestin level is going to drop, and they may start to get their menstrual period, and when estrogen drops, if it does at all, and what effect that's going to have on premenstrual dysphoric disorder. So I hope this helped you out, and I hope that you are able to use this information when you get a new pack of pills that you've never seen before, that you'll be able to use this knowledge to look at it and understand what makes that pill pack unique and the properties of that pill pack.